Let's go beyond the connection. Welcome to the podcast today. I'm Steve McDonald, your host, and we've got a very special guest on today, Claus Jensen. Now, Claus, what makes you very special is beyond even your Chief Technology Officer role at the University of Texas Medical Center. You've been a Chief Innovation Officer before. As I was scrolling through your LinkedIn, I just stopped counting how many advisory and board memberships that you had over time. I'll let you talk a little bit more about that. But what's intriguing about our conversation, a number of different things, is that you were looking at the business of technology as much as the adaptation of the technology and the evolution of itself and that application to our business. And you mentioned something that threw me back a little bit, which I think was your intention. You talked about future backwards thinking and how CTOs should be building today's technology by a future backwards mentality. And I'm going to let you explain what all of that is. But first, if you wouldn't mind, just explain a little bit more about your background before we get started.
All right, very cool. Thanks for having me, Steve. Very much appreciate it. Now, let's see, where do we start? I've been in a couple of countries. I was born in Denmark. I lived in the US for 17 years. I have, as you called out, been a Chief Technology Officer, Chief Architect, Chief Digital Officer, Chief Innovation Officer. So I've had a few of those chief titles. I actually like Chief Storyteller. That's my preference. That's the one I like the best myself. So think of me as a technologist turned storyteller. There are lots of stories you can tell through the lens of technology. In the time I've been a technology professional, about 4 decades or so, you get older. Increasingly, technology is just part of the business. And I think at one point in my career, we all had choices to make. And I had to decide whether I want to continue to be technology specialized or whether I wanted to go into what you call business applied technology. And so for the last at least 15 years, maybe 20, that's been where I spend most of my time. How do you actually think about technology as a fundamental part of your business and how you make a difference? It doesn't mean that you don't have all the other responsibilities that come with the job. You usually do. You got to have to keep things running. And if something bad happens security-wise, people are going to look at you with those eyes. So that's still part of the job. But what fascinates me is how business changes over time through the combined power of technology and innovative thinking.
That's the perfect segue to having you explain what you mean by future backwards thinking versus current forwards thinking or planning.
It's not something you will find in most literature. So it's just a term I've been using for a while. Most times when you try to make something better, you start with what you have. If you look at Six Sigma, any kind of improvement framework, it's almost always look at what you have and then you figure out what you want to change. Even when you're deconstructing things, you still start with what you have, you deconstruct it and you put it back together. And that's what we do most of the time. Sometimes we get an opportunity to say, well, that's not actually what we're trying to accomplish. In our case, we're building a new academic medical center, an actual physical building and all the stuff you put into it. And if you look in the history of constructing academic medical centers, hospitals in general, for the vast majority of them, when they open, they're outdated. That's just a fact, because it takes a decade to build one. And with the speed that things are changing, both in clinical science, in logistics, and in technology, it's outdated 10 years later. So how about taking a different approach and asking yourself, well, what does 2040 probably going to look like? And everybody will say, Claus, you can't predict what 2040 looks like. And I'll agree with them, because nobody can actually predict the future, but you can prepare for it. So how do you prepare for the future? By imagining that you have a future that you're going to have to hit and then you think backwards as to how you get there. It's the kind of thinking we sometimes use when we do strategic planning. We think about the milestones, but it's just taken to a higher degree where how about thinking about the whole construction project that way and asking yourself, what do you want to be in 2040? So what do you need to do now to get there and make sure that new construction environment works, both in 2030, 2040, 2050, and 2060. It's actually kind of mind-boggling how it changes the conversation if you start with the future and then you try to go backwards. And by the way, the teams that normally build building, they don't know what to do with that. So we're having some fun conversations.
If you could give us some examples in your world, in the reconstruction of the medical center and what 2040 looks like, that's now driving the thinking of what you now actually have to build today.
Let's see. In 2040, you will have robots and humans intermingled in the hallways in all kinds of different ways. It's like in today's world, you would say, where's the robot corridor and where's the human corridor? Wrong assumption. In 2040, you're going to be commingled in the same space. So we're not going to have any robot corridors. We're going to be making our regular corridors 10 feet wide instead of 8. One simple example. In 2040, you will do individualization of the treatment at the point of care. Think about what that means. It means that your pharmaceutical cocktail, your biological treatment, think CAR-T treatments, etc., your microbot component of your treatment, because I think in 2040 there will be microbots that are part of treatment. All of that is programmable at the point of treatment. What that means is you need a production lab that can manufacture or configure the particular individualized treatment that you're going to get in the very advanced academic medical center we're going to become. So we actually have 6,000 square feet of a production lab that does all kinds of things like that. Can I tell you exactly what's inside that lab in 2040? Of course I can't. But not having this space means that I would have a problem in 2040 and probably before. So those are two simple examples. I'll give you a third one. As house consumer expectations very rapidly shift from we're part of a transactional process and it becomes more about a longitudinal relationship and experience matters more, maybe we should rethink this whole notion of waiting rooms. What if we apply a concept of lounges instead? And what if you make those lounges not just a place you work, but a part of the functional programming on the environment? So when you're leaving the facility, maybe that's where you get your wearables. Maybe that's where you meet your clinical technologist, new term, new role, that will help you get enrolled in those follow-up programs that make a difference. Maybe that's where you can wait for an hour and a half if your ride is late, and you will still be under supervision of the clinical care team that will bring you down. So you're not actually sitting in your patient room is one example. So rethinking what waiting space looks like. Those are 3. Right now, we are up to about 30 ideas like that fundamentally change what the world looks like, and expect to have about 50 when you get to the end of the year.
You had mentioned one thing that I think fits into this model. You talked about it as remote surgery or virtual presence revolution. If you could explain that, because that really talked to me personally about the evolution of care and what we're going to have to plan for.
So the idea is simple, and the implications are rather profound. You and I are not in the same room. We're in a virtual connection. If you fast forward that to what if in 2040, it is normal that you can have virtual, hybrid, and in-person presence blended together in any of the clinical spaces in a new facility. It's an interesting thought. Like, we're not just talking conference rooms. We're talking the exam rooms. We're talking the ORs. We're talking everything. There are people out there, I know some of them, that have been in the forefront of robotic surgery for a long time. They've done successful surgeries from 1,000 miles away, 2,000 miles away, 3,000 miles away. And think about what that means for deploying expertise outside your own walls. So whether that is one of our specialists that are beaming themselves into an OR somewhere else, let's say rural Texas, or whether it's the other way around. There's a world-renowned something that we don't happen to have, but is one of our partner academic medical centers, maybe they will be present during one of our surgeries. It's not as far-fetched as it sounds. These are things where you can see the bones of the technology existing. You just have to shoot you backwards, think what that might look like if you're truly saying that that is prevalent in everything we do across every single important space in the facility.
So this takes what, in my mind, where there are so many things that are happening on site, on premise, now off premise, and in the world of like Internet of Things. And I think you called it perfect situational awareness and like a blanket and sensor network. Can you kind of do a much better job than I just did what that means and why we should be talking about it?
So that's another one of those 2040 backwards hypotheticals. For the last 2-3 decades, we've had more and more specialized equipment and sensors because you could build a sensor, a piece of equipment for something special. But in the age of AI, maybe that's not the right metaphor. Maybe you can actually have generalized sensors, but specialized algorithms. Think about how much more flexibility that gives you. If you can use general audio, video, lidar, temperature, pressure, humidity sensors, and you can have smart algorithms that interpret what that means, maybe you don't need a bed that costs a gazillion and does fault detection. Maybe your algorithm does that. And maybe it even does a better job of it because it's got more data points. If that's something you want to pursue, you have to start thinking about how many sensors is that? It's a lot. And I can easily count to somewhere between 10 and 20,000 sensors in the new facility, which is about 1.5 million square feet. Right? So 20,000 sensors is a very large number. Is at the scale that normally you only have utility companies trying to manage. But here we are, emerging hospital facility. That's what we want to do. So you have to rethink what that means from a overall connective tissue perspective. You have to rethink what that means when you start talking about things like edge computing. What is edge computing in this case? Is even the ability to process that amount of events happening and filter signal from noise.
Now, with a lot of chief technology officers that I talk to, this proliferation of sensors and the Internet of Things has proliferated the conversation about wired and wireless technologies and the acceleration of wireless technologies. In your world, in your application, how has that changed as a chief technology officer? How you create the connective tissue of the network that brings this all together?
It's a really interesting question. I think you have to start with the basic principle of healthcare: do no harm. So it's an interesting principle, man, because if you look at how we do clinical trials, if you even look at the oath that you take as a new medical doctor, I'm not, by the way, but I've got a few in my family. The basic principle of healthcare, at a minimum, do no harm, preferably help people, but at least don't do any harm. Let's apply harm to technology. What's harm look like? Well, if you're in the middle of remote surgery and the network goes boom, that's not good. If you're using sensors to monitor whether people are doing the wrong thing in the patient room and the sensors go boom or the network goes boom, again, that's not a very good thing. So the more you bake technology and connective tissue into how you just operate as a provider entity, the more you have to think of that technology not just as business critical, because it is. We all know that if we blow up the technology in any organization these days, it's probably not a healthy place to be. But it's mission critical because you start impacting patient care. Most hospitals historically have had the ability to fall back to pen and paper only. I don't know whether that's going to be the case in 2050, 60, 70, 80. So putting in the bones now to make sure that you have double or triple redundancies on everything, not just relying on wireless or wired, but maybe doing both and start thinking about what does that look like, becomes an interesting equation. It does also push the envelope on what even makes up the network. Because most facilities today have more than one. They have one for nurse calls, they have one for guest Wi-Fi, they have one for whatever messaging system that the clinical teams use. You can't afford to make all of them as robust as what I just talked about. So one of those shoot to backwards questions is, how far can we push the envelope on just using one connective tissue across the entire facility, but using it for multiple purposes? That one, I don't know what the answer is yet. There are also various legislatory constraints on what you can and can't do around things like nurse calls. So there's work to do, but you can see the thought that if I really want to make my network robust, how many things can I use the same network for?
And the idea of the network isn't contained just in the building that you're building here. You brought up the idea of edge technology and care. It might be a patient that is in need at the site of an accident, a crisis, or something like that. And so no matter what, how do you think about the total care that you're providing and the network that connects it when the building is just a part of that? A very important part of that.
So there's like two angles to that question, I think. Question is asking yourself, what is the role of the building in the whole equation? What is the role of the building itself? Historically, we have always asked the question, how can the building support, enable the care team, the research team, the education team? What if that's the wrong question? What the right question is, how can the building be part of the care team, the research team, the education team? It's an interesting tweak, and it sounds like, well, that was just, Klaus, you switched two words. Yes, but I completely changed the nature of what the building does and is. Because now it's an active participant. It's not just enabling humans. It is actually in and of itself an actor in all of care research and education. So that's the one angle to an answer to the question. You just change the role of the building. With that said, part of what the building can provide and what the network plus the building can provide is perfect situational awareness. If you think about it, one of the things that plague any large, complex organization, organism, enterprise, system, whatever you want to call it, is you only ever get the pieces. And you're making decisions based on pretty imperfect understanding of what the systemic state of the entire entity is. Well, why did you change that? If your 10 to 20,000 sensors gives you enough, and you have power and funnily enough edge compute capabilities, is it going to be perfect? No, but you can definitely construct situational awareness that is a lot better than what people have historically been able to create. So maybe we should rethink this notion of a network to say, actually, the network in and of itself is nothing. What matters is the situational awareness that the network and a few other bits and pieces creates.
That network is it is the connection. It is the connective tissue. And I want to go back to something that you said a little bit earlier. I forgot to do that because I was caught up in what you were saying, is that maybe we need to have not just single, double, triple redundancy. People's lives are on the line. It's not just like most of us in our business, if we lose our network, yes, there's an impact financially, there's an impact productivity. Nobody's going to die. You have a very different situation here. So when you think about network redundancy, what is different about how you think about it if you're doing forward, future thinking backward, versus if we just think of the networks we have today, currently, and how we improve them? How does that business philosophy of how you think about it change?
I think the biggest change is probably that the way I would think about the network is that it is a business operational construct. It's not actually a technology operational construct because it doesn't just carry pieces that help the business. It is the business. It sounds so simple, but without the network in the kind of future that I'm painting, bad things can happen, and there are certain things you can't do. So think about what that requires from a partnership perspective. How do you even have the conversation about what the network needs to be able to do? Historically, you sit down in a group and you huddle as a group of technologists and you think about what does the network need to do. I would argue that's no longer sufficient. You need to have a conversation with the nurses, with the physicians, with the clinical operations team, with the facilities team. There's like a lot of other people that you now need to have a conversation with to say, what does the network look like as a business construct? What does it actually do?
You know, what it does, there is the future backwards thinking. There's also lessons learned from just our mistakes or major events like a COVID-19. And I'm wondering, like, what were some of the biggest lessons that you learned during COVID-19 that you're taking forward?
I had been at the Memorial Sloan Kettering Cancer Center for a whopping total of about 4.5 months. And if you remember back, New York City was COVID center at the time, right? By a lot. And it was completely out of control. So on a Friday afternoon, I think it was a Friday afternoon, I'm pretty sure it was, the mayor of the city gives us 48 hours notice he's basically going to shut down the city, like completely, and let nobody in, nobody out other than essential staff. So that meant we had to send home 40 to 45% of the staff and still run the hospital. 48 hours. So you start thinking about that, is okay, this thing, the people we have to send home, what do those people do as the very first thing? They call forward their phone. We ran out of circuits to call forward within the first couple of hours after the people got sent home. Okay. All right, you start fixing that. Now you got much more people that are going to try to do their clinical work from remotely. We ran out of Citrix connections. That's a fixable problem. We ran out of telephony lines, and we didn't have enough lines in our call center because we got lots of people, thousands of people tens of thousands of people all of a sudden working from home, and they all have got problems. So they all call in. So we started running telephony lines in the hallways in the office building where the technology team was sitting. We took 2 conference centers and turned into impromptu call centers pretty much overnight because we had to. And here's the kicker. So we know that we're not getting the bandwidth we need from the telco providers. You'd think that you would prioritize the clinical traffic because you're supposed to. Turns out when we reached out to them, they said correctly, there's all these people sitting at home and gaming. Okay, get that. But why am I not getting my bandwidth? Well, we don't know how to prioritize. Oops. It wasn't actually at a granular level built-in mechanism so that you could dedicate specifically that the traffic to this one institution on this one tunnel gets preferential treatment of the overall copper and fiber backbone. So what I learned was you just can't predict the kinds of challenges that you run into, and you have to be able to roll with the punches. But while you can't predict the future, I do think you can prepare for it.
So, as Chief Technology Officer, and the audience here is other CTOs, other network administrators, executives that are responsible for keeping the networks up and keeping our businesses and keeping what we do alive and operating. If you were to make your top 2 or 3 recommendations, what would you want to impart to them in terms of what they should be doing and thinking? Because you've done this at a level that I think a lot of us haven't before. So I'd love to share some of your knowledge that way.
Maybe 3 things, if that's okay. The first one is one everybody has heard before, but you haven't necessarily thought about what it actually means. It is always about the people. It's always about people. It's about your own leadership. It's about your extended team. It's about the people that you serve inside your organization, and it's about the people that you serve outside the organization. It's always about people. If you don't understand people, you can't be the best possible leader that you could be. And there are just so many technologies, Spider-Man myself included, at one point in time, that are a little bit uncomfortable with the fact that it actually always comes down to people, not technology. So that would be number 1. The second one we talked about, you can't predict the future, but you can prepare for it. If you choose to be willing to think differently about problems, you can actually prepare for the future. Perfectly? No. Adequately? In most cases, yes. We've all heard the whole inside the box or outside the box kind of thought model. And look, I can't remember how many times people have said, Claus, you think outside the box. And sometimes I'm tempted to say, no, actually, I don't. I ask myself, what box? That's actually different. You've got people that are in the inside the box mindset. You've got people that are in outside the box mindset, but you're still seeing the box. And then sometimes you let yourself, when you're trying to prepare for the future, just say, I'm not seeing any box. And if you want the essence of what future backwards thinking actually represents, it's that mindset. Please, I'm not constrained by the box of now. I'm trying to define what might a different box that represents the future look like. So what box mindset? Number 3 is actually related to that whole, so these 3 are related. It's always about the people. It's you can't predict the future, but with the right people, you can prepare for it. And part of that is what box thinking. And I really think you need to know who your chief storytellers are. Who are the people in your organization that just nascently tell stories about who you are, what to do, the art of the possible? That's the driving force, I think, in many cases, not for a sprint, but for a marathon. Think about it. What motivates humans? And there is research that documents this. If you tell a good story, the number that some researchers came up with is it's 28 times more powerful than any set of facts that you find. 28 times. How they calculate 28, don't ask me. But that was what the research said. And look, I've seen that in practice. Stories are just very powerful. Not necessarily in the moment when you're trying to just do something small, a sprint. It doesn't even have to be small, but it's a short amount of time. But if you're talking quarters, years, half a decade, maybe a whole decade, it's the story that carries through. It carries your culture, it carries your value, it carries your vision, And at one point, I had a sat down with a conversation with my own team, and we were talking about technical leadership, and said something along the lines of great technical leaders are characterized by vision, by conviction, and by their technical proficiency. And in most cases, we start with the technical proficiency. But the reality is, if you're trying to lead to a different future, then your vision and your conviction are what's going to carry your team over the long haul.
And you may not even need to have the level of technical proficiency that your team does. Not all leaders have the capabilities of their team, and they shouldn't. That's really important.
So if you don't know who your storytellers are, it may not even be you. If you don't know because look, it's not better or worse than other skills. It's just a skill. But just make sure that you know who they are. And if you don't know who they are, go find out. And if you don't have any, maybe you want to hire one.
I think that stat, the 28, came out of a Harvard Business Review study that was done, because I've read that and we just remember stories better. It sticks with us. We carry it forward. We remember it. And that kind of goes to my very last question, which is, we've covered so much territory here. In our poor human brains, we can't remember more than about 2 or 3 things at a time on average. But if there was one takeaway that you wanted the technology leaders that were tuning into this podcast today, the one thing you wanted them to take away, what would that be?
I think be clear on 2 things. The one thing you need to be really clear about is what matters to you as an individual. What will you be proud of leaving behind? What truly matters in your heart of hearts? What actually makes you feel like you accomplished something personally? It's the one thing. And then the other thing is be really clear-sighted on what you're unusually good at, and for what areas where you're good, but you're just as good as most other people in similar roles. That clarity of thought, if you can let that lead your career choices, I think it will serve you well. And if you're as privileged as I've been in most of my career, I can look back and say, I left things better than I found them.
Here's the one thing that I know, Claus, is going to happen. People are going to have questions. Is it okay if we give out a link to your LinkedIn profile that people can reach out?
Absolutely, yes.
The mission of this podcast is very clear. It's to bring different, unique perspectives and insights from leaders all over the industry, all over the world. And if we do that, we can all help each other by individually being a part of that rising tide. And I just wanted to say, I think you were an amazing part of that rising tide today.
I appreciate that. Thank you.